Thank you so much, Hunter. Let me just pop these slides up real fast.
Absolutely. The magic behind the scenes. We're gonna have
I know.
yeah, that's so cool with the Olympics and snowboarding and all of that. Must be very exciting.
It was definitely a fun experience. Let me
Cool. Well, we can see your screen. You're looking good.
hold on. I just gotta get it to hit play.
Sure.
All right. Can you see everything just fine?
I can see everything. We can also see your notes, just so you're aware.
All right. Let
I
me
know
uh
it's
let
tricky with
me
with Zoom sometimes and all of that.
is that better?
There we go. Looks
Okay.
beautiful.
Wonderful, wonderful. Now that we have the tech aspect out of the way, we can get into the real reason why everyone's here. So great. Thank you, Hunter. Like he said, I am Riley Steinmetz. I work at Carrot Fertility, and today I'm going to talk with you a bit about why fertility benefits are a critical piece of diversity, equity, inclusion, and belonging. If anyone has any questions at any point, please feel free to share those in the chat. I'll try to keep my eye on that and save some time at the end for those. But I'll also share my contact information in case anyone wants to reach out or you want to have a longer conversation about any of this. So thank you all for being here today. So I wanted to start off with an informal poll. So in the chat box that I just mentioned, I'd love if you could share whether you know anyone who has used fertility treatments like IVF to grow their family. And do you know anyone who's used adoption, donor eggs or sperm, maybe surrogacy? Do you know anyone who's frozen their eggs or sperm? Give you a second to share those responses. All right. Well, yeah, I mean, as we can see from the responses here, it looks like there's yes, all of the above. There's a lot of different ways that people grow their families today, and it's becoming more and more common to see people using fertility treatments, adoption, surrogacy, and so much more as part of their journeys to becoming parents. In fact, it's now the latest stat I saw is that a third of American adults now say that they know someone who has used a fertility treatment to have a baby. And I mentioned egg freezing, so I did want to share just one example of how far we've come in a brief period of time. Egg freezing only 10 years ago was still considered experimental within the medical community. And it was most often offered as an option for those who are going through cancer treatment that may impact their fertility. And now, of course, that's still incredibly important, but it's also become a common consideration for many people in their reproductive years, even without any sort of medical diagnosis. And that's really just the start. Still, even though, as we see from these chat results, society is becoming more open, more accepting, and more supportive of all these different journeys and the ways people pursue parenthood. But there are a lot of things that haven't changed. And one of the really big ones that I'm going to talk a lot about today is that these journeys can be quite expensive. And historically, most health insurance programs have offered little to no coverage for these services. So what do I mean by that? So most health insurance revolves around infertility and not fertility. And it's an important distinction. So the first definition, or the definition used for infertility, is unfortunately far less inclusive than that you usually find for fertility. Medical infertility is most often defined as a heterosexual cisgender couple trying and failing to get pregnant via unprotected intercourse for 6 to 12 months. So you can probably see some problems with that right from the start. So it completely excludes single intending parents or members of the LGBTQIA community who are trying to pursue parenthood. And even for those who do meet this very narrow definition of medical infertility, many fertility treatments aren't even considered medically necessary by insurance companies, so they're not covered. So let's say you successfully met all of the criteria for medical infertility, and you've learned that your health insurance plan will indeed provide some coverage. Should be smooth sailing from here, right? Unfortunately, that is not typically the case. Even when someone does meet these criteria, like I was saying, that coverage is limited. It rarely covers everything that's needed to pursue family building. Oftentimes it covers diagnostic care, like blood tests to help you identify things that may be issues down the road. But it very rarely covers actual treatment like IVF or intrauterine insemination or IUI. And even in the 17 US states that now require some degree of coverage for infertility diagnosis and treatment, there's a ton of exclusions. Many of these mandates actually exclude treatment altogether and don't require any coverage for fertility medications. And it should come as no surprise to anyone here that those are often two of the most expensive aspects of pursuing this type of healthcare. And that whole conversation was solely around treating medical infertility. And when we get into donor-assisted reproduction, accessing donor sperm and eggs, gestational surrogacy, or adoption, those are almost never covered by insurance, and they get expensive very quickly. So with that double whammy of lack of insurance coverage and high prices, the vast majority of people pursuing this type of care, in fact, 80% of people, end up taking on debt to pursue it. The average debt accrued by someone going through fertility treatment is about $30,000. And as you can see from these average costs on here, $30,000 is kind of just the start. And so while family building is usually the main thing that people think about when they're thinking about fertility healthcare, since we are talking about diversity, equity, inclusion, and belonging today, I wanted to touch on one other rarely discussed piece that is a really important part of inclusive fertility healthcare, and that's menopause and drops in testosterone later in life. Again, it may not be the first thing that comes to mind when you think fertility, but the winding down of those reproductive years is a really critical part of fertility care. And it really impacts employees. So many of the experiences that people go through while aging interferes with work, and work typically doesn't provide much support. We recently conducted a survey of people going through menopause, and 79% of the people working with menopause symptoms said it was incredibly challenging. And unfortunately, only about 8% of them have any sort of menopause-related resources at work. And it's not just those workplace resources that are the problem. It's a pretty common misconception that people going through these natural life transitions have readily available medical support through their primary care providers or general practitioners. If you look at menopause, though, the reality is that only 20% of OBGYNs have done any sort of training in menopause, and that number is even lower for other types of providers. So if you want to create an age-inclusive workplace supporting lifelong fertility health, this is definitely something you want to keep in mind. All right, so now I wanted to transition a bit to what kind of support employers can offer to help folks navigating the complex world of fertility care, hormonal aging, and family building. We've established that there's a challenge with fertility healthcare facing a good portion of employees. So how do fertility benefits enter the equation? What exactly are they, and what exactly are they going to do to help? First off, the category name fertility benefits is a little bit misleading, kind of like we were talking about earlier with that infertility versus fertility. If you're really looking to establish an inclusive fertility benefit, you want to make sure you're not only looking at infertility. Ideally, fertility benefits should support fertility healthcare needs and things that fall outside of what people normally think of as fertility, like adoption, gestational surrogacy, and support through menopause and drops in testosterone later in life. So you know what to include, but how do fertility benefits work? So depending on the vendor, they work in a few different ways. So sometimes they are integrated into your existing health plan. Other times they're separate from your health plan, and then your employer may also offer some funds that you can use to specifically pay for fertility care. They also typically include care navigation, so helping you get to the right place at the right time in your journey. And then oftentimes they include access to virtual chats with experts like physicians or lawyers to help you navigate those different aspects of your journey in a little bit more depth. So it's easy to just list out a bunch of things that are often included in fertility benefits, but to make this a little bit more real, I wanted to walk through a few different scenarios that I've experienced in my time at Carrot that really showcase the kind of difference that fertility benefits can make in an employee's fertility healthcare family forming journey. So first up, let's meet Kat and Nicole. So they've been married for 5 years and they are ready to grow their family. They've talked about asking their close friend to be a sperm donor, but they're not really sure how to navigate the legal side of that process. So they ultimately end up deciding to go with a sperm bank. They find a donor they like, but they're pretty surprised by the costs. One vial of sperm costs about $1,000 and their insurance won't cover any of it. So they tap into their savings to purchase the vial and make an appointment at a fertility clinic near their home in Dallas. Their insurance would cover IUI if they were a heterosexual couple that had been trying to get pregnant for a year, but since they're a same-sex couple, they won't. So they have to pay for all of their care out of pocket. While their clinic is convenient, the staff makes them feel a little bit uncomfortable. So every time Kat goes in for testing with Nicole, she gets questions like, "Where's your husband?" And she's had multiple instances of people in the clinic referring to Nicole as her friend or her sister. Unfortunately, after trying twice, IUI is not successful for them. They're not sure what to do next. Do they pursue IVF? Do they try another cycle of IUI? Do they explore a different path to parenthood altogether? They've also run out of donor sperm, and they know that will be an additional expense if they're to pursue more options. So that would require tapping into their savings yet again. With all of this, they decide to pause the process and regroup to learn more about their options. So what resources would have made this process go a lot more smoothly for Kat and Nicole? First, as we've talked about a lot at this point, employees should be able to access Carrot without needing an infertility diagnosis. And that's a very common hurdle for same-sex female couples who are pursuing fertility care. Next, care navigation is a very important aspect for members of the LGBTQIA+ community pursuing parenthood, because there are a lot of moving pieces and it can be important to know where exactly to start and where to go to find affirming care. So care navigators could have helped Kat and Nicole choose a sperm bank. They could have helped them answer questions about what to consider when looking for a donor. They could have helped them navigate using a known donor like their friend. And they would have understood how many vials of sperm they should purchase. Care navigators can also help folks find inclusive clinics in their area and places where doctors and staff are known to provide affirming care. And if Kat and Nicole had access to legal support, like I said, they could receive legal guidance on safely using a known donor if that's the direction they wanted to go in. So this is a pretty standard set of challenges a same-sex female couple would run into. Next, I'm going to move on to another example. This is an example of Kathy. Kathy is VP of sales at her company. She's been there for 5 years. She recently started having trouble sleeping, which is making it harder for her to focus at work. She also started having hot flashes during the day, including during meetings. And she had a suspicion that maybe this was menopause related. So she made an appointment with her primary care physician to learn more about her symptoms, as well as other symptoms that have been bothering her, like anxiety. She's heard about hormone replacement therapy, but she's heard mixed things, namely that it can increase her cancer risk. So she's a bit nervous about trying it and definitely wants to get a medical perspective on if it's the right road to go down. She goes to her appointment with her primary care provider and feels dismissed. Her primary care provider says these symptoms are just part of life, so just soldier on and they'll let up eventually. So she does just that. Her symptoms don't improve though, and she starts to use her sick time when she's feeling particularly exhausted. She hates missing work, but she really doesn't feel like she has any other option. And after a few more months of this, she finds an opportunity that would allow her to take on a different job that allows for more remote work and flexible scheduling. And ultimately, she opts to take that job and leave her current position. So we don't talk about the impact of menopause symptoms at work very often, but they're very common. Of people experiencing menopausal symptoms, 40 to 60% experience sleep loss and 40% experience mood-related symptoms like Kathy. And her story about struggling to find care is not unique. Like we mentioned earlier, only 20% of OBGYN residency programs provide any sort of menopause training, and only 9% of primary care physicians will proactively talk about menopause with their patients. There are a lot of different resources that can help here. So first off, having expert created educational resources can help people find answers to understand these symptoms without needing to turn to Dr. Google. Care navigators, again, can be very important here because they can help employees find those doctors who do specialize in menopause symptoms, the ones who have had that training that so few physicians have had. And this is important because both menopause and low testosterone are important times in life when you're making a lot of other important health decisions. So connecting with doctors who have experience treating people at this time of life is really important. And finally, we've heard from many, many people that being able to connect with others going through the same experience can be incredibly impactful. So some fertility benefits vendors will also include support groups or guided group talks on topics like menopause and low T so that people can share their stories and find support in their community. All right, one last story for you here, and then we'll get into some other things. So I wanted to introduce you all to Catherine. Catherine is a 28-year-old cisgender Black woman who has been trying to get pregnant for about a year. She's not sure if there's anything else she should be doing or when she should start thinking about options like testing or IVF. She's tried talking about her concerns with her regular OBGYN, but was told she was young and she should just keep trying. She left her appointment feeling dismissed and wasn't really sure what next steps she should be taking. Discouraged by the process, she just decides to keep trying without seeking further care. So for employees like Catherine, there are again a number of resources that could have helped her find better care. I'm sure this is not news to anyone on here, but research shows that Black people in particular are likely to have negative experiences within the US healthcare system compared to white people, and that members of the BIPOC community receive better care when they're seen by BIPOC providers. Fertility benefits that support care navigation can support employees in finding providers that share their racial or ethnic background if that's something they're interested in. Related to fertility in particular, members of the general public and even doctors may believe the stereotype that Black women are hyperfertile. And this is unfortunate because research suggests that Black women experience infertility at almost twice the rate of white women. Despite that, research also shows that Black women are less likely to use IVF, and when they do, have worse outcomes than their white counterparts. And part of that is because Black women generally start treatment 1 to 2 years later than white women. And because age has a significant impact on success rates, that means it often takes longer and requires more rounds of IVF to get pregnant. And so misconceptions around fertility is definitely a huge cause here. And then financial barriers can also impact access to care for everyone. So providing financial support for all fertility, healthcare, and family forming journeys can make a significant difference no matter what your background is. Beyond fertility treatments, there are a lot of other challenges that BIPOC people face when trying to access fertility care. If you're going down a donor-assisted reproduction route, it can be really challenging to find non-white sperm or egg donors, for example. That's another instance where care navigation can come in handy because it can help employees navigate the complexities of these donor-assisted reproduction journeys and understand their options and guide them to places that may better understand those challenges that they're facing. So these 3 stories were just 3 examples of instances where fertility benefits would help. But this diverse range of support is just one of the many reasons why fertility benefits can be so impactful for supporting diversity, equity, inclusion, and belonging in your organization. If you do have any questions about specific journeys, please let me know in the chat and I will try to answer those. In these next couple of slides, I'm going to get into how you know, like, so you've decided you want fertility benefits, how do you take action to get the right fertility benefits in your workplace? So for the HR professionals in the room, a big part of this is identifying a partner who will actually support your efforts around diversity, equity, inclusion, and belonging. As I mentioned before, there are a lot of different things that you need to kind of look out for. So I have a few questions here that can really help guide that vendor search. So I'll just read through these quickly. What resources do you provide for education and care navigation? As we discussed, care navigation can be a huge part of all of these very complex journeys. So it's really important to understand what type of support different vendors offer there. Do you offer emotional support and legal resources within your platform? We didn't get deeply into the mental health aspect of these journeys, but these can be very long and trying and really weigh on people. So it's really important that they have that emotional support to help them along the journey. What options do you provide for employees who may prefer to avoid IVF if possible? What is the process for employees wishing to access these? So we didn't really talk about avoiding IVF in the previous slides, but contrary to popular belief, although IVF is a very common family forming journey, it's not always the option that people need to pursue if they're having challenges getting pregnant. There are a lot of non-invasive options that people can explore before going to IVF if that's what they would like to do. So it's important to provide coverage for that. Tell me a little bit more about your process for adoption and donor-assisted reproduction. Is it the same as you handle IVF, or is it a separate process? This is really important when we start talking about, feeling like each of these different journeys is kind of on equal footing with vendors. Some vendors are very IVF focused, so they have a very streamlined process for helping people get through IVF. But when they decide they want to go through adoption or gestational surrogacy, there's almost like a secret path that they have to jump through a few hoops to access. So it's important to give all of your employees equitable experiences. Do you offer easy to access coverage for donor-assisted reproduction and adoption? Does it include access to legal resources? How are you assessing your product for member experience? Are you assessing factors like LGBTQ plus friendliness or BIPOC provider availability? Do you offer virtual access to experts? And do you support hormonal aging through menopause and drops in testosterone? So these are just a few questions. I'm happy to share these after the presentation, but just a few things to keep an eye out for. And so I did want to also give some resources to the non-HR pros in the room who want to get the discussion going in your workplace, because that can be a little challenging to know where to even start. So first up, know that your HR team wants to hear from you. Most employee benefits changes actually start with requests from employees. So it makes sense since benefits are here to benefit employees. So to get that request in, set up a meeting with one of the benefits leaders on your HR team. If you're not sure who to turn to, just start asking folks. And people are in benefits because they want to help people, so they will help you get to the right place. And once you've figured out who to talk to, the next step is to do your homework. So have some data and stats on hand. We've shared a lot today. We have a lot more on our blog at carrotfertility.com. But go into this meeting with a proposed solution and anticipate the questions that might come up. So how many people will use this benefit? How much will it cost? Where are our current offerings not quite hitting the mark? So you don't need to go in with a PowerPoint, but having these numbers in your back pocket can definitely be a big help. Beyond those stats, if you're looking for support for specific journeys, get specific about it. So do you want a benefit that covers surrogacy or doesn't require an infertility diagnosis? Use what you learned in today's presentation to make that case for inclusive benefits. And let them know that fertility benefits are flexible. Even a small amount of coverage can be expanded in the future and have a big impact. And we're all here because diversity, equity, inclusion, and belonging is important to us. And hopefully your organization feels the same way. So know your diversity, equity, inclusion, and belonging goals going into this discussion and be clear about how fertility benefits can support those. And lastly, consider finding some allies. So this is a benefit that impacts a lot of people. Many of you may already lead employee resource groups at your company, so you know how powerful they can be. But for those of you who don't, this can be a great opportunity to get involved. These groups bring together employees with shared experiences and backgrounds, and fertility benefits can impact almost all of those different groups. So in terms of working with folks at your organization, ERGs can be a wonderful place to find strong support for implementing fertility benefits. And one of the things, I won't get into all the details of Carrot since we are at time, but before we wrap up, I did just want to share that one thing that all of the stories we shared today have in common is that Carrot Fertility offers resources to cover all of the things these people needed in those stories. And we help people navigate those fertility healthcare journeys along the way. So, we really prioritize inclusivity, and we are here to support everyone in their journeys along the way. So thank you all for joining today. And if you have any questions, please do not hesitate to reach out. Let's at get-carrot.com. And yeah, thank you.